In today's video, I'm going to be talking about what it's like being on antipsychotic medication, as I've been taking one for over half a decade now. The first part of the video will cover what exactly they are and what side effects I typically experience. And the latter half of the video is how they affect my psychosis and moods. And the way they actually treat my symptoms is the true meat and potatoes of this video, because that's where all the crazy stuff is. Anyways, antipsychotics themselves can seem like a really scary medication, and let's be real, just saying the word antipsychotic has its own level of shock value. But I take one every single day to manage my mental illness. And if you are new here, welcome. My name is Kit, and I have something called schizoaffective disorder, which is a condition where someone experiences symptoms of schizophrenia, such as delusions and hallucinations, but also symptoms of a mood disorder, either major depression or, in my case, bipolar. Now, with that out of the way, let's get started. So, what exactly is an antipsychotic? It's a class of medications that work to, well, reduce psychosis, but it's much more complicated than that. The first antipsychotic, chlorpromazine, was put on the market in 1952. It revolutionized psychiatry because it enabled people with psychotic illness to actually recover from their symptoms and episodes. And they could go on to live what could be considered a fairly normal life. Eventually, more antipsychotics came to market, and over time they were put in two major categories: typical and atypical. Typical antipsychotics were characterized by acting on dopamine receptors and are known for having really rough side effects. While atypical antipsychotics, mostly what we use today, act on both dopamine and serotonin receptors and have a much more tolerable side effect profile. And while we don't know exactly how they work, we know that they do work, and that's what's important. So let's talk about side effects, aka things that are all part of the psychiatric medication experience. The biggest and most frustrating side effect I experience as part of taking my current antipsychotic Zyprexa is that I have unwanted muscle movements. And an important thing to note here is that dopamine isn't just a feel-good chemical, it's also a key neurotransmitter involved in movement. So when a drug messes with dopamine, it can cause things that are very similar to Parkinson's disease, like stiffness, tremors, and rigidity. And these side effects fall under an umbrella term called extrapyramidal symptoms. I also get sleepy right after I take it, so typically I just take it at night and then just go right to bed. Other than those things, I sometimes get lightheaded when I sit down and stand up too many times in a row, and sometimes I get so restless I want to crawl out of my own skin, but those moments are fortunately rare. But now I guess I should address the elephant in the room. A lot of people who take antipsychotic medication experience weight gain, sometimes a lot of it, and I want to speak on that for a moment. Weight gain is a side effect of antipsychotic medication, which means that, by definition, not everyone will experience it. For me, I've been on multiple antipsychotics over the years, and most of them have actually killed my appetite and made me lose dangerous amounts of weight. And as a result, I have lasting health issues from certain antipsychotics. Seroquel, or quetiapine, was a drug I was on for a time that made me lose nearly 20% of my entire body weight over the course of a month and a half. I had no hunger, and I was throwing up nearly everything I ate. And even before that, I was struggling to eat when I was put on Abilify. I lost a lot of weight on that one too, and my friends had to remind me to eat for months. And I know many people struggle with the weight gain side effect, but I need people to know that the opposite can happen as well. And it too can cause drastic effects on health. Zyprexa is the only one that hasn't done any of that to me, and I'm really grateful for that. And now I want to talk about psychosis, aka what antipsychotics actually treat. Being on antipsychotics has not made my psychosis go away entirely, but it has made it more manageable and less frequent. Before I went on Zyprexa, I actually heard voices almost constantly, but I was far from miserable. They were my friends. But unlike when I went on Abilify, which didn't really affect my psychosis at all, Zyprexa made them change. And not in a way I was expecting. With them being around less, I quit hearing the regulars, which meant that I quit hearing my friends. And new ones rose up to take their place, and not all of them were kind. I eventually got used to it, of course. But these days, the voices come and go. And I'll get fragments of conversations, sentences, things like that. Sometimes I'll get to talk to them a little bit before they leave. Sometimes I'll have a long, well-needed discussion. And sometimes I'm just glad to have some company and not be alone in my head all the time. And one thing they didn't tell me when I first started taking antipsychotics was that it would change the way I think. And the thing is, I heard voices for years. I was always having a conversation in my head when there was anything going on because I always had someone to talk to. So thinking in conversation, for lack of a better term, was just how I lived my life. So with the voices going away, I had to teach myself how to think without them. And it was really weird for a time. I mean, I got used to it, of course. I had to. But regardless of what happens in my day-to-day life, whether someone shows up or not, I've made it work, and I'll continue to make it work. And that's just how life is for me. As for my delusions, Zyprexa came down like a f***ing hammer on them. And I'm not really gonna get into what exactly my delusions are in this video, because that's not really a story I enjoy telling, but I have told it in other videos and I'll link them in the description. But anyways, after Zyprexa, I maybe get delusional a couple times a year. It's so very rare, and I'm really grateful for that because frankly, my delusions terrify me. But I'm so far in treatment now that when they do happen, I recognize them as lies, and like my hallucinations, I know they will go away eventually because my meds work really, really well. And yes, it might sound a little bit shocking, but sometimes those who experience psychosis know it's psychosis when it's happening. Treatment is wild. Next, I want to talk about how antipsychotics affect my moods, because some of them can have mood stabilizing properties. I was first put on Abilify after having a rather bad bipolar episode. We were using Abilify to treat what had become a mixed state, or a bipolar symptom in which someone meets the criteria for both mania and depression at the same time. And it worked. It snapped me out of that awful situation. Then I went off of it because it was just a temporary thing meant to fix the episode and get me back to normal. And as you might be gathering by this point in the video, I went on Zyprexa to actually treat psychosis. But it had a dramatic effect on my moods that I didn't see coming. Before Zyprexa, I spent a lot of my life in depression. And after Zyprexa, depression became something that was rare for me. And I definitely don't get manic like I used to either. I instead get hypomania, which is a much less intense form of mania that can be fun and productive. And it doesn't ruin my life. And of course, I still have episodes that knock me on my butt. My channel is proof of that. But they're less intense, and often I can live and work through them just fine. Zyprexa makes my symptoms less disabling. And that's what it's like being on antipsychotics. If you take them, what's it like for you? I would love to hear your thoughts, so let me know in the comment section down below. And if you want to learn more about how psych meds have changed who I am and changed me as a person, I made a video that you can click on over here all about answering those questions. But other than that, thank you so much for watching this video. I will see you in the next one. Bye bye.